Good afternoon, everyone, and thank you so much for joining in. I'm Krista Hoffman. I'm the Executive Director of the Jefferson County Development Authority, and I am excited for the program that we have this afternoon. And I'd like to introduce Jim Klein. He's the Sales and Business Outreach Manager for Hospice of the Panhandle. So take it away, Jim.
Thank you very much for having me today. I'm going to work the, the technology here today. I'm going to start the screen share. And while I'm doing that, I'll just tell you a little bit about what we're going to talk about today. Planning for the future, navigating supportive and advanced care is the plan. Let's hide the floating meeting controls. Those little boxes should go away here in a second or two, and we're going to get started. The objectives for today are going to be trying to share some information to help everyone understand the difference between what hospice care means and how Panhandle Palliative Services work. I'm going to provide an introduction to our social services manager. She's going to share more information on the process that is advanced care planning. She'll help share information about the steps. And again, this is a process, not an event, and she will help to identify other ways that Hospice of the Panhandle could interact. So let's just take a quick look here at just a few slides that help to identify what we are. Hospice of the Panhandle is a nonprofit organization. Hospice is a type of care and philosophy in which a terminally ill patient and the family has made a decision to forego further aggressive treatment. The focus becomes symptom management and comfort care. So that's the important part of what hospice services provide. However, palliative care is an area of healthcare that focuses much more on relieving symptoms to make the patient as comfortable as possible. So what you'll see in the illustration is that hospice and palliative, sometimes those words are used interchangeably, but a hospice program and a palliative care program are not the same. The palliative program operates with the same principles as hospice. However, it's a more holistic approach that aims to provide symptom management. So the palliative care program allows for patients to continue to receive aggressive treatments, whereas hospice care, the family or the patient have made the decision to allow natural disease progression. So most important, in the palliative program, an NP may come to the house if there are ambulatory problems. An NP may help to identify symptom management while the patient still undergoes, perhaps it's dialysis, chemotherapy, or some other type of curative treatment. So those are the two distinguishing factors that I wanted to present before we get started with advanced care planning. Many people know a good bit about Hospice of the Panhandle. However, we have a Center for Grief Support, which does not require that a patient, the family, or the community be involved with Hospice of the Panhandle at all. We have volunteer services. We honor veterans as a program that takes place here through hospice. And of course, I've already mentioned hospice care as well as Panhandle Palliative Services. So at this time, what I'd like to do is I'd like to share some information about the expert, the person who's been here 11 years and she knows some stuff, is Julie Sayre. She's an MA, LSW, LMFT, lots of acronyms that she has, and she's a dedicated and clinically licensed marriage and family therapist and social worker. As a social services manager at Hospice of the Panhandle, she oversees social work, bereavement, chaplain services, ensuring compassionate care for individuals with life-limiting illnesses and their families. Julie has a strong background in end-of-life care, grief counseling, and pediatric hospice services, having developed the organization's pediatric care policy. She holds a master's in human development and family studies from the University of Connecticut, UConn, and has experience as an adjunct professor and child protective services worker. Passionate about advocacy and ethical care, she continues to support patients, families, and professionals in navigating the complexities of hospice and palliative care. And really, Julie is the backbone of advanced care planning. I've learned quite a bit from her in the last 14, 15 months that I've been here at Hospice of the Panhandle. So I'm really grateful that she was able to collaborate and really to help drive sharing this presentation with the community. So at this time, Julie Sayre, please take over.
Thank you, Jim. I'm going to take you with me any room I go in and start just having you announce my presence. That's impressive. Thank you. So why are we here today talking about advanced care planning? Really, advanced care planning ensures that your healthcare wishes are honored when you can't speak for yourself. And that's really important. So now you can make your own decisions for yourself, for your medical care, but there may come a day where you can't do that. And so we want to make sure your wishes are honored. Consider this. If you were in a car accident or suddenly unable to communicate your healthcare preferences, would your loved ones know what you want to do? Would they know what treatments you would want or not want? So advanced care planning relieves the burden on your family members by giving them the confidence to make decisions aligned with your values. Slide, please. So in West Virginia, there are several different types of advanced directives. There's two main categories. One are traditional advanced directives. These documents are intended for future healthcare decisions. The living will cannot anticipate all possible circumstances, and the medical power of attorney is able to understand the wishes and apply them to circumstances. So we have the medical power of attorney document, and it designates the person to make healthcare decisions for you if you're unable. The living will document, it documents your wishes regarding life-sustaining treatment. And the 5 wishes document. This document is recognized in 46 states, covering, and this entire document covers medical, personal, emotional, and spiritual needs. So any of us on this call can have these documents. Whereas when we move to actionable advanced directives, these are physician's orders. They're put into effect immediately. Decisions are based on current healthcare status and present clearly defined end-of-life care requests related to specific medical conditions. So these documents are filled out by persons with chronic illness, serious illness, or terminal illness, or advanced age. So these are the people who are most likely to be going in and out of the hospital or to have a medical emergency at home and have EMS need to come to the home and know their wishes. These documents are most likely found on the refrigerator at a person's home. That's the universal place for them to be kept so that medical professionals can see them clearly and know what your wishes are. A do not resuscitate card, that's the little orange card there on the screen. That specifies if you want or don't want resuscitation in emergencies. The pink form next to it is the physician's order for scope of treatment. It's the medical order indicating care preferences. It goes into more detail about if you would want to be kept on ventilation or if you would want feeding tubes, etc. So these DNR and post forms go wherever the patient goes, home, hospital, nursing home, in an ambulance. We're not going to talk any further about those 2 documents today, but they are important, again, if you were in any of those categories of specifically terminal illness, advanced age. Slide, please. So what happens when there's no directive? 2 things can happen. If you're in a hospital, let's say, and you need a medical decision made currently and you lack capacity, a physician would make that decision for you. And that person would be called, they would appoint someone called a healthcare surrogate. So the doctor appoints a healthcare surrogate based on a line of succession in the state of West Virginia. So starting with your spouse, if you have one, adult children, moving on to siblings, parents, etc. That healthcare surrogate then makes all of your medical decisions for you when you can't. Without advanced directive, decisions may fall to family members that you might not have wanted those decisions to be made by, and they might not know what you want either. So This can also lead to disagreements or decisions that don't reflect your true wishes. So by creating a directive, you can retain control over your healthcare choices, even when you can't speak for yourself. The other option is guardianship. So a guardian's appointed by the courts to make decisions when there's no living will or medical power of attorney, or appropriate person to appoint a healthcare surrogate. This option can be costly, and it can take several weeks to work through the guardianship process. I should probably state now, if it's not obvious from the bio that Jim read, in my schooling, I am not a lawyer and I'm not going to be giving legal advice today. So that's my disclaimer. All of this paperwork that we talk about today, medical power of attorney, 5 wishes, focusing on medical care, medical decisions can be received through the West Virginia Center for End of Life Care, and the website. I'll talk about that further on in the presentation. But these are focused on medical decisions. I will talk a little bit more about financial documents and give you advice to seek a lawyer at that point. Slide, please. So today we're going to talk mainly about this booklet called 5 Wishes. And the reason for that is because it breaks down into nice categories or wishes, the 5 important things that we want to think about as you begin your journey into advanced care planning. And as Jim mentioned, advanced care planning is not a one-time thing. This is an ongoing process. So when you're thinking about it now and you go to do a directive, you can change that. What you think about now and you make on your piece of paper, either 5 wishes or a medical power of attorney, may change 5 years from now. You want to keep this document updated. As your conditions change and your personal medical needs change, as well as the people around you change. So who you appoint to be your medical power of attorney today might not be the same person that you want to make those decisions 5 years from now, and you should redo that document. So the 5 Wishes booklet, I said, is applicable in 46 states. There's a nice little map. We had that question this weekend of what 4 states it's not applicable in, so there it is. And we in the Eastern Panhandle of West Virginia are obviously really close to other states. So I often get the question, well, I had my medical power of attorney document done in Maryland. Will you honor that? And the answer is yes. At Hospice of the Panhandle, we will honor those documents. We often have that happen because people get care across state lines all the time. So again, if there's a lawyer on the call and they want to tell me something different, please speak up at any point. But we're going to honor those documents. Oh, Nikki's talking on the chat. I should probably not pay attention to that. Someone else just let me know if there's a question. So the 5 wishes are broken down into wish number 1 is the person that I want to make decisions for me when I can't, or in other words, your medical power of attorney. Wish 2 is the kind of treatment that I want or don't want. Question 3 is how comfortable I want to be. And question 4 is how I want people to treat me. So questions 2, 3, and 4 relate more to the living will portion of what kind of medical care that you would like to have. Question 5 is what I want my loved ones to know. That gets more into the spiritual and emotional well-being, also into some funeral planning that you can write down on this so that you can have your family know your wishes in the future. Next slide. So medical power of attorney, or wish 1 in the 5 wishes booklet. The person I want to make decisions for me when I can't. This allows you to designate someone that you trust to make healthcare decisions on your behalf. It's important to choose someone who understands your values and is willing to advocate for your wishes. Communication is key. Discuss your preference with the person ahead of time. Julie, why is it important to have this document if I am married? It's going to default to my spouse anyway. Well, that's a very good point. But I always give the example of, if I don't have this document and my spouse wants to keep me alive forever and ever, and that's not my wish, then I should probably appoint someone else. that is going to know my wishes and know that I want to not be on a ventilator forever and know that I want comfort care because I'm such a palliative advocate over here. And so instead, I would here as my representative, I would put my sister because she knows my wishes and she would follow through with that. That's a difficult decision to make, but it's one that I want to make so that I'm in control of my medical decisions and not a physician. So making sure also that then the people in your life know who those people are and understand it, have those conversations. Next slide. So the start of the living will portion of this document is wish two, the kind of medical treatment I want or don't want. And a living will outlines the medical treatment that that you want or don't want in specific situations, such as a terminal illness or permanent unconsciousness. The document guides healthcare providers and loved ones during these emotional, challenging times. So in this document, you can go to the next slide, Jim. I just want to show. The beauty of this document is that it does give you the option in different circumstances. So I often get asked, well, what happens when ... I'm in a coma for 1 week and then I want to be taken off a ventilator, but only if ... Unfortunately, we don't know all the circumstances that are going to happen, for our medical journey. And in a living will document, you can only spell out general wishes that you have. This document can give you certain circumstances that maybe your wishes would change. Maybe if you're close to death, you would want one thing, but if you're in a coma, you would want something different. And so you're able to choose those wishes on this document. You could want the same thing, and that's fine too. But it gives you the opportunity to make those choices for yourself. The other beauty of this document is for people who have never thought about advanced care planning, it helps walk through those questions. Whereas doing a medical power of attorney document, strictly a medical power of attorney or strictly a living will, just has you write in the blank, yes, I want this person, and you sign. This is more of a conversation starter. You can bring this home to your family. You can say, hey, let's sit down and walk through this. What would you do in this circumstance? And helps guide you on that conversation. Next slide. So wishes 3, 4, and 5 talk about number 3 is how comfortable I want to be. So this really focuses on pain relief, warm baths, personal care, and religious readings. You may think, well, don't I want all of those things? Well, not everybody wants all of those things. There's certain religions, certain cultures that actually believe suffering is part of the end of life journey, and in order to get to where they want afterlife. And so it's really important for you to spell those wishes out for your family so they know what you want, or for your medical providers. How you want people to treat me. Do you want people to hold your hand? Do you want spiritual practices? Some people don't want that. Some people do. The other question, the last one, talks more, these are messages to your loved ones. So this starts to touch on some legacy building. What messages do you want to give them? It includes forgiveness and also final wishes, so dealing with funeral arrangements. It doesn't spell out, it certainly isn't pre-planning, with a funeral home, but it gives your family a direction to go in. So I do want cremation. That could be a real gift to your family if they're struggling with that decision at that time to say, oh my goodness, we don't have enough money for a funeral, we're going to have to cremate them. I don't know if mom or dad wanted to do that. Well, if it's spelled out in this document, you already made that decision for them, and they're honoring your wish then. Next slide, please. So I have some frequently asked questions that we get when doing advanced directives. And the first one is, kind of already touched on it, but do I need a lawyer to create an advanced directive? And the answer is no, you certainly can. There's a plenty of great estate planning lawyers in the area, and they will help you and guide you through this. But you don't have to have one. So you do have to have a notary though, and 2 witnesses that are not related to you by blood or marriage and that are over the age of 18. So every social worker at Hospice of the Panhandle are notaries. So our patients often cannot leave the home. We can go to them, notarize documents, and have witnesses that are not related to them, AKA our other employees, so that we can do these documents for them at home. Next slide. Another question that we often get are, I already completed my combined medical power of attorney and living will document. Well, you just talked about the 5 wishes booklet. Do I need to do both of them? My recommendation is no. You certainly could do them, and whichever one you did most recently would be the one that would be in effect. Okay. The reason I say my recommendation is no is that you've already completed the medical power of attorney and living will document. That information is what is in the 5 wishes booklet. The 5 wishes booklet just spells out a little bit more personal, emotional, and spiritual preferences. So instead of completing another advanced directive, just have the conversation with your representative who you appointed to be your medical power of attorney and tell them those things. Unless you feel like they're not going to follow through, and then perhaps you should do another advanced directive anyway. Next. What happens if I'm in a car accident? This question is often asked. EMS has one job, that is to save your life. They are going to save your life in that moment if they can, and take you to the hospital, and the emergency room without further instruction are going to do the same thing until they can stabilize you. At that point, then decisions are going to be made about life-sustaining treatment. So when we have a medical power of attorney or living will document, those are made for the point where doctors are deciding for life-sustaining treatment. Are we going to continue this treatment? They are not going to know in the middle of a car accident if you don't want life-sustaining treatment. There's not a way to figure that out. Or even if you had a DNR card at home on your refrigerator, that's not in the middle of that car accident. So they're going to save your life at that moment. Go to the hospital, and then your family, though, are going to have your wishes on file, be able to bring them to the hospital if they're not already there to say, actually, mom or dad do not want to be on that ventilator any longer. We need to take them off of that. So the important piece of that is for your medical powers of attorney, the representatives, to have that document, because they need to know where to find it in case they need to bring it to the hospital, or that they are enacted in that representative role. Next slide. Okay, so what's the difference between a medical power of attorney and a general or durable power of attorney? This is when we start talking about the difference between medical decision-making and financial decision-making. So the medical power of attorney gives someone the authority for your healthcare decisions only. A durable power of attorney or general power of attorney gives someone authority to handle finances or legal matters. The durable part means that it stays in effect if you become incapacitated. So I have seen many different documents from lawyers' offices that say at the top, power of attorney. And then it breaks it down into medical power of attorney. There's a statement about a medical power of attorney, and then there's durable powers of attorney. So if you do have a document that was written by an attorney. These could all be combined into one document, or they could be separate documents. So if you already have your documents, knowing what you have is really important as well. I can't tell you the number of times that we ask people for their medical power of attorney and they hand me their durable power of attorney and say, that's what that is. And I have to say, no, that's not what that is. They can handle your finances. That's great. But we need someone to handle your healthcare decisions. And that is a different person and a different line. Does that all make sense? So I would recommend going to an attorney to have a durable power of attorney or a general power of attorney written. The same thing with a will or a last will and testament. I don't know that this is a slide. I'm going to go ahead and say it now. The other question that I get is, what's the difference between a living will and a last will and testament? A living will is the document that talks about your medical wishes, and it stops at the time of death, because after that you don't have any medical wishes, right? A living will and testament is what you do with your estate, funeral plans after you die. Makes sense? So they're two separate documents. Okay, next slide. Oh, there it is. Just got ahead of myself. So now that I just sped through that, okay, Julie, great. All of this sounds fabulous. There's a bunch of steps to do. How do I get started? Well, on April 16th is National Healthcare Decisions Day. And they do that right around tax time, because the only thing guaranteed in life are death and taxes. And so every year when you go to do your, I didn't make that up. I know it's cheesy, but that's really a thing. And so every year when you go to do your taxes, it's recommended that you review your advance directives. And if it's the same as it was last year and you still agree with it, great. If it's not, you can have it redone. And that's why it's an ongoing process. Okay, so on April 16th, in the Berkeley Medical Center lobby, Hospice of the Panhandle and the care management team at BMC are going to be there, able to help you do your medical power of attorney document. We're notaries, we're going to have witnesses. You can have it done in the matter of minutes. Very easy. And there's no charge at all. Just we want to be able to give this service to the community. And we will have the documents there. You don't have to print anything out. We can have conversations. You can chat with us. The other thing is, okay, I'm not really ready to complete the documents yet. I want to learn more. This is where you can go to the West Virginia Center for End of Life Care. There's a lot of resources on that website. It's where I go first stop if there's any questions that I have, or I email them. They're a wonderful resource. And they are the experts in this area in West Virginia for advanced care planning. You also, at any point, any community members can call Hospice of the Panhandle, ask to have their advance directive notarized, and come in and make an appointment. And any of our social workers will do that at no cost to you. It's a service that we love to do for the community, and want to make sure everyone has their advance directives. Next slide. So how would you call us to make that appointment? Or if you had a loved one or family member that you're thinking would benefit from any of our services, here's the phone number to give us a call. We serve not only Jefferson County, but Berkeley, Morgan, and Hampshire's counties. And we, most of the time, would respond to that and come see you in the same day. Next slide. I didn't mean to make it a 30-minute presentation, I promise. I just went through it really quickly. So what kind of questions does anybody have?
Hey, Julie, I will mention that someone posted in the comments that copies of 5 Wishes should be available. There should be a couple copies at Jefferson County Development Authority. And I believe that our community relations specialist, Dylan Gray, also delivered some to Shepherdstown Public Library. If those two locations would be closer than visiting us here in Carneysville at 330 Hospice Lane. But copies of 5 Wishes are available to pick up at one of those 3 locations.
Wonderful. Thanks, Jim. Anybody else?
Julie, I'll jump in and just mention,
Thanks.
hi, that Hospice of the Panhandle is the host facility for a death cafe that I facilitate, and sometimes the counselors there if I'm not available. And the next one is actually tomorrow at 3 o'clock, 3 to 4:30 at the Hospice Center for Grief Support. It's the left-hand building when you're coming up that drive. And I'll be happy to make sure that we have some of those documents available at the Death Cafe. Death Cafe sounds a little freaky, but it's a cafe just because I serve tea and cake, and that's my promise to you. And then it's an open conversation with whoever gathers about questions related to death and dying and preparation like this. So it might be a really kind of low pressure, welcoming way to kind of begin to think about those conversations that you may not have had yet with your family. So I'll make that offer.
Absolutely. Thank you, Tracy.
Well, if there's no other questions or anyone else has any other questions, again, really like to thank everyone for their participation. Very special thanks to Julie Sarah. I know that she's passionate about advanced care directives and planning. There have been other presentations in the community. If anyone is interested in more information or a speaking engagement at one of your local groups, please don't hesitate to let us know. You can call 304-264-0406 and ask for myself. I'm Jim or Dylan or Julie. Either one of the 3 of us could help to get a speaking engagement scheduled, or if you know of someone who could benefit from additional layers of supportive care, whether or not it's through the palliative program or the Center for Grief Support, people interested in volunteering, please don't hesitate again to use that number or look us up online. So a special thanks to, I think, to Krista and Taylor. We appreciate the opportunity to share specific information about the services we provide, especially in anticipation of April 16th, National Healthcare Decision Day. Better to be safe than sorry, well-informed, prepared. So again, thank you so much for the opportunity today. Taylor or Krista, is there anything else or?
I don't think so. That's what, just to touch on, you can pick up the 5 Wishes documents at our office. We're also located in Carneysville, but we're at 1948 Wiltshire Road at the Jefferson County Public Services Building. So we're not that far away from Hospice of the Panhandle, but you can always come over and see us too. We do have, I think, about 10 copies available if anyone needs anything. Or if you want to get them after hours, I can put some out in the vestibule. You'll have that door is unlocked all the time. So you can just go into entrance B, grab it, and leave at whatever time of day works best for you.
And I thank you for your time and for thinking of us. We're always happy to, present this important information to the public.
Thank you all. Have a good afternoon.
You as well. Thank you,
Thank you.
everyone.